Good morning, friends. It is October 21st and it's really early in the morning, but I'm up because I wanted to give my leg a rinse with HibaCleanse before I go get my Excision today. If you're new here, I am getting an Excision today because I had a biopsy done on a mole or like a freckle that I've had on the back of my left leg for years, like at least I'd say like 9 years, and it just looked a little bit odd this time when I got my skin checked. So they took a biopsy at my dermatologist, and when it came back mostly normal, but there were some atypical cells. So to err on the side of caution, and since I am a breast cancer survivor, I have a history of cancer, I'm going today to have an Excision done and take like a nice big margin around where they did the biopsy. So I'm gonna take you along with me for that part of my journey. So I'm gonna quick wash my leg, get ready. I like to use the HibaCleanse. They didn't tell me to do this, but from having had 3 surgeries in a year last year, I know it's good to decolonize the area just to help with skin healing and wound healing. Also, I reached out to my oncologist about a week ago and I said, should I still be on Verzenio with an Excision? And she said, you know what, hold your Verzenio for the week and then a week after this procedure, just to help with wound healing, because Verzenio lowers your white blood count. So it's just all a fun part of being a breast cancer survivor and being in treatment still. All right, so I'm gonna get to cleaning this and I will check in from the car. So I'll see you in the next clip. Okay, so I am in the car getting ready to head out to my surgery, my Excision surgery. It's technically a procedure, but also a surgery. We're gonna get on the road and I will see you in the next clip. Okay, I'm here and I'm actually like 35 minutes early. I figured I would just head right over. My appointment's for 9 a.m., but it's in a highly congested, trafficy area. So I was like, well, I'll just drop my daughter off at school and go right there. I'll probably get there right on time because of the anticipated traffic I thought I was going to get stuck in. And here it was just like a normal morning. So I'm really early, but that's okay. I get to chat with you guys for a minute and then I'm going to go in. Maybe they'll take me early. Who knows? But I just wanted to tell you real quick. Where is it? All I'm bringing with me is my water, because it's always good to stay hydrated regardless in life every single day. And coffee, like the essentials of life, water and coffee. And as you know, I fast in the mornings. I fast until lunchtime, so that could be anywhere between like 12:30 and 2:30 in the afternoon. My allergies are completely flared up. That's why my eyes are like not happy right now. They're like watery, but I did take an allergy pill. It will kick in soon. It always takes a couple hours to kick in. And I got my lymphedema sleeve on as always. So that is it. I'm gonna go in and check in and hopefully get my Excision done sooner. I don't know if I'll be able to record the actual procedure because it is technically like a office visit procedure, I think. I don't know. This is a surgical center, so maybe not. I remember when I had one of these done years ago on what I thought was cancer. I think I talked about this in my last video, but it ended up being a hemangioma. Weird. But when they did it, I was in like a regular office laying on my stomach, and then they used local anesthesia and they just did the Excision. I was wide awake, laying on my stomach, yapping away the whole time. They were like cutting open my leg. I didn't feel anything. So I'm assuming that's how this one will go. But it is in a surgical center, so I don't know if I'll be able to record much. And I'm definitely not going to record. I don't know if I'm going to show you guys the wound, because I feel like YouTube would be like, what are you doing? That's a flag. I don't know. I'm going to look into that. But I don't know if you even want to see it. It's going to look pretty gnarly. So if you want to see what granular tissue looks like, just go to Google and type in granular tissue, granular tissue, and you'll see it's pretty gross looking, but that's part of the healing process. So that's what my leg's gonna look like. Nice circle, just big old smiley face on the back of my calf. It's better than cancer though. It's better than skin cancer, so I'll take it. Just looks like a bullet wound. I'll have to come up with like a cool story of like how I got it. I'll just make up something really cool and like adventurous, like, wow, I survived that. It was just an excision. All right, I'm gonna get in there and I'll see you in the next clip. I'm gonna talk as quick as I can. Quick room tour. They go really fast here. But here's my leg. It is marked right there. So they're gonna be taking a margin. I'll send a picture here. Oh, and I'm attached. I don't know if you can even see this, but there's this blue cord attached to my back. So they can monitor my heart with the cauterizer thingy. Okay, bye. Well, I'm all done. I'm walking to the car. I'll check in from the car and let you know how it went. That was so fast. I'll see you in the next clip. Okay, I'm back in the car. I cannot believe how quick that was. It was total 45 minutes from triage to checkout. It was exactly 45 minutes. That's crazy. So I got sent home with some paperwork on how to care for my wound. I'm so glad I didn't show you guys well, I'm not able to anyway, but I'm so glad you weren't able to see the wound because it was very, very gory. I thought it was cool. I'm into the medical stuff, so I was like, this is really cool to watch. But when they were wrapping me, I peeked down at my leg and I was like, blah. It's very gnarly. It resembled, it's perfect time for Halloween. It resembled like zombie brains or something coming out. Wow, it was so gross because it was like a big hole in the back of your calf. So what's back there? Fat tissue, and couldn't see the muscle or anything, but it just looked really gross. So today is compression, where they wrapped my leg to make sure it all stays in there, it doesn't spill out. And yeah, I just take care. I wash it once a day. And I'm like, I have Hibiclens at home. Can I use that? And they were like, yes, that's actually like the best thing to clean it with. So wash it once a day with Hibiclens. They sent out the piece that they took out, the margin, they sent that out to the lab. So I'll get results within about 2 weeks to make sure they got it all. No cancer cells were detected. No atypical cells were detected. And I follow up in 2 weeks. I don't have to come in, which is really cool. They said just send a message through my chart. I love my chart. Like, if you don't have my chart and your doctor does use that, please use it. It is amazing. It's like a little pocket patient organizer. Like it kept track of all of my, it still keeps track of all of my cancer treatment, all of my appointments, and my Zometa infusions, my Zoladex injections, everything, all treatments, my surgeries, everything. Definitely use my chart. It's the best thing ever. I'm so glad it exists. But yeah, that's pretty much it. That today I have to keep the dressings on, and they said whenever you're sitting or have a chance to sit, they're like, it's on your leg, so they keep it open. They can't stitch it closed just because of the location of it and the movement of your muscles when you walk. So it's okay to be on my feet today, but whenever I am sitting, they said to elevate and put some ice on it just to help with any inflammation or swelling that might happen. But all is good. I'll keep you posted. It should heal normal just like the other one did. And I'm still off of Verzenio for 1 more week after this just to help with wound healing. But yeah, all in all, this was a pretty cool experience. And I'm I'm just happy that if this, God forbid, would have eventually turned into skin cancer, it's out of my body now. And I want you to make sure, if you have not gotten your skin checked this year or ever, you better go get it checked, because skin cancer is no joke. It is cancer of pretty much all kinds. Don't quote me on that. I'm like 95% sure every single type of cancer out there, whether it is breast, bone, lung, testicular, they all can pretty much, you don't feel it. And when you do feel it, it's too late, usually, most of the time. Or it's really, really a late stage and it's harder to treat and cure. So don't forget to get your skin checked. That's just my little reminder to you. Get your skin checked and make sure you advocate for yourself. All right, so I'll check in with you later and let you know how the healing process goes, and then I'll probably close out this video. So I'll see you in the next clip. Good morning. Today is Wednesday, October 29th. I had to think, what day is it? It is officially a week and 1 day since I had my excision surgery on my leg. I'm not going to show pictures because that wound is gnarly. There's no other word to explain it except for gnarly. And the healing process is just as gnarly. But I'm actually feeling really well. There was one day, I think it was like day 5, where I felt sore and like a little bit of tightness in the wound site area, and it looked to me a little bit like pinkish around the edge where they actually cut the excision out, or the perimeter of the wound. I don't know what I'm saying. But it had me a little worried for like a second, because I'm like, wow, it's pretty sore and tender. Like if I sat for longer than 15 minutes and had to get up, it was like real tight. But rest assured, it is totally normal, and it's just part of the healing process. And when I went to clean the wound the next day, it looked beautiful. Like for healing, it looked really beautiful. And I think what it was is, since there's an actual hole like cut out of my leg, my skin is like slowly closing inward, or trying to regrow and close inward to protect my body. And like, I'm just fascinated with the human body and how it just knows what to do. Like, we have an injury, send in the aid. Like, I don't know how it just knows how to do it. It's just amazing. Our bodies are amazing, and I love my body, and I hope you love your body, because it's so cool. It just blows me away. I don't know why I'm like fascinated by it. Like, this is my first wound of life. It is definitely not. But just to watch an open wound, like there's no stitches. So it's just literally like a big open, it's like the size of a $50. It's big on the back of my calf, and to watch it slowly heal is really fascinating. So it's the cool stuff you get excited about when you're older. I'm into it. But anyway, I wanted to take you along with me today because I'm getting a Zoladex injection, and I haven't taken you with me for a while for one of those. So I figured before I close the video out, we'll just have a little rendezvous trip down memory lane of what I do every month for breast cancer treatment, ongoing treatment, post-surgery, post-chemo, post-radiation, and that is endocrine therapy. So I am on these Zoladex injections for 5 years. I'm actually coming up on year 2-ish. Technically, I think spring will be 2 full years. That's crazy, right? Yeah, I think it was April 2 years ago. So I'm like a little more than a year and a half in of monthly injections. So anyway, I'm gonna stop yapping and get on the road. So I will see you in the next clip. right, so I'm in the chair. They're gonna go get the shot from pharmacy and give me my injection, and then I'll be on my merry little way. So I will check in from the car. All right, so I am back in the car. Of course, I couldn't walk past my dog Coop without taking a selfie with my dog Coop. It's the cutest statue ever. Anytime I'm here, if I'm able to, sometimes there's people standing there waiting for their ride, and I'm like, all right, I won't be awkward and take a selfie with a dog statue. But when nobody's around, I'm like, boop, and I take a quick little selfie with it. So cute. Anyway, that is pretty much it for this video. I will be back here in November to meet with my oncologist. I meet with my oncologist, I think every 3 months now. We like moved it out a little bit because it's pretty routine. And I also will be back here in November next month for another Zoladex injection, but I'm also getting a Zometa infusion. If you don't know what Zometa is, it is a zoledronic acid infusion. It's done by IV. So I will be in the infusion chair just like when I was getting my chemo, same song and dance, but instead of accessing a port, I don't have a port anymore. They just do a regular IV in your arm or your hand. So, and I only have one arm that they can do it with because I have lymphedema now in my cancer side arm, or where the cancer was. So that typically takes about like an hour and a half, sometimes 2 hours from start to finish for that infusion. So I'll definitely bring you along with me for that, just in case you've never seen it before. I have done previous videos. This will be my 3rd infusion. So I did do 2 other videos with my 2 previous infusions. If you want to watch those, you are more than welcome, or just hang out and wait until this infusion. You can come along with me on that and see how it all works and the steps to get it done. The cool thing with the zoledronic acid is it helps to prevent bone density loss. Now, being on endocrine therapy and being on hormone, like estrogen suppressant hormones, I take a daily pill, I get a monthly shot, just like I did today. It ages you quicker as a woman. Suppressing your estrogen can really affect your bone density and can cause early onset of osteopenia or, God forbid, osteoporosis. So getting the zoledronic acid stops your bone density from getting worse. So if it is already bad, it won't get worse because of this. And if you have very good bone density, it'll keep it right where it's at while going through this endocrine therapy for 5 years. There are side effects to the zoledronic acid. The main scariest one is necrosis of the jaw. It's always something that I'm checking out and making sure if I feel any type of difference or pain in my jaw, I would immediately address it. But so far so good, knock on wood. It typically is more, it's very rare, but it's more common in patients who get Zometa infusions monthly. I don't. I go every 6 months for the next 5 years. This will be my 3rd one. So I already got 1 year down. I got 4 to go. So I'm just praying to God that it just stays the way it is. My body handles it the way it's been handling it, and I don't have any negative side effects. The positive side effects of Zometa is obviously it helps to keep your bone density strong in your bones all throughout, and it has been proven to prevent a secondary breast cancer or a recurrence of a breast cancer. So I'm all for that. I was like, sign me up. Go ahead. Gimme. Because you don't want to have that happen again, especially if it traveled distant. Like, it's just good to have one more thing that is helping to prolong your life. That's basically where I'm getting at. So I'm very grateful for it. So yeah, that is pretty much it. I'll check in next month when I go for my oncology follow-up appointment. I will be getting blood work again for that as well, because they have to check your blood count before they can give you the Zometa. She said today they check for calcium and something else. I forget the other one. Not white blood count, but they check calcium and hematocrit. Maybe. I don't even know if that's the correct one, but they check a couple of your blood levels to make sure that you're able to even get the Zometa infusion. So I'll be getting blood work done. seeing my oncologist, and getting Zometa next month. Real quick, before I hop off, in 2 days, it's Halloween. It's my favorite time of year. I got my Jack Skellington shirt on today. Christmas and Halloween, they're pretty much tied, but I'm going to say Halloween's a little bit more my happy heart. So I just love it. I don't know. I just love the weather. I love the crisp fall air. I love the colors of fall. I love the pumpkins and jack-o'-lanterns and kids dressing up, and sometimes even I still dress up. It's just fun. Like, trick-or-treating's cool. It just gets me excited. I love all the colors, all things witchy, everything. So if you celebrate Halloween, I want to wish you a happy Halloween, and don't be too mischievous on mischief night. And yeah, that's pretty much it for now. I want to thank you for being here on my journey. I appreciate you supporting me through my journey and just following my journey from day one. If you've been here from the beginning, I appreciate you very much. And I hope I've helped you in some way, shape, or form, or helped somebody that you know and love and care about in some way, shape, or form, because breast cancer, any cancer diagnosis, is very earth-shattering. It rocks your whole foundation to the core. But I just want you to use me as a tool to know that you will get through it. There is life afterwards, and you are like so much stronger than you even know or realize. So I just want you to know I'm proud of you, and just keep on swimming, one day at a time, one fusion at a time, and one hurdle at a time. All right. I love you guys so much, and I better see you in the next one. Bye, everybody.